prostate cancer is typically a silent disease.
I was having urination problems. It was slow urination. It was sometimes painful, which was not normal and was odd to me. And we did a test, and within that test, we thought we just had a enlarged prostate. So we medicated for that, and that did nothing.
So doctors like myself diagnose prostate cancer typically through a screening program, which includes physical examination as well as serum blood testing using a screening tool called PSA. Doctors will often use PSMA PET scans because they can identify disease when it's small, and it can do so more accurately than conventional imaging like MRI, CT scans, or bone scans.
Going for a PSMA PET scan was the defining result which I needed to know what process we were going to take from there.
Prostate cancer screening is very important to identify disease, particularly in the early state.
Once we found out that I had metastatic prostate cancer, there was only one thing I could do. I could go to chemotherapy. It's very important that there's more than one ear in the room. To have another set of ears when you're talking to your urologist, because they can ask questions that you may be embarrassed to ask. And it is an emotional ride. So don't be afraid of that.
This type of precision can change the path forward. So I want to talk to someone who knows firsthand about this technology. It is a urologist, Dr. Paul Yonover, who's also helping lead the way in bringing this scan to more men across the country. Thank you, doctor, for joining us from Chicago. PSMA scans, they're here.
Yeah, they're here, and they have really changed how we approach diagnosing and treating prostate cancer pretty rapidly.
You know, we're talking privately about our enthusiasm for this scan. Can everyone get one?
Right, so PSMA scanning is really helpful in helping define a patient's diagnostic and therapeutic journey. After a patient is diagnosed with prostate cancer, a PSMA PET scan like Illuccix can help define exactly where the disease is and the extent of the disease. If there is recurrence, PSMA PET scan can help identify where that recurrence is and how extensive that is. So it's really changing not just the diagnostic, but also the therapeutic landscape.
What's the biggest difference you've seen for your patients because of the scan?
One, it's giving us a level of accuracy we didn't have before. So I can have more confidence, and that's helping contextualize the patient's journey. And that's been actually from a patient-facing perspective, also game-changing, not just from how we approach the disease, but how patients are perceiving their disease.
What would you say to any patient listening now?
We have technologies like PSMA PET scan, which can help them better understand the nature and extent of their disease in a much more accurate way. And I think having those tools available to them will help replace fear with knowledge.
Dr. Yonover, thank you so much for joining me and providing us with this great story. I'm very excited about this. Thank you.
Thank you for having me.
Now, you can learn more by going to Illuccix.com. That is spelled ILLUCCIX. Don't go away. We'll be right back.
Important safety information.
There is a risk. PET scan images with Illuccix may be misinterpreted or may be affected by other factors. Illuccix involves exposure to small amounts of radioactivity. Long-term cumulative radiation exposure is associated with increased cancer risk. The most commonly reported adverse reactions include fatigue, nausea, constipation, and vomiting. These adverse reactions each typically occurred in less than 1.2% of patients in clinical trials. This is not the full important safety information. The approved uses and additional safety information is available at www.illuccix.com/safety information.